In January 2025, a healer stepped in his patient's neck so hard until he died. The healer suffocated him as a result of catching the devil spirit that hunted the patient's body. You may not believe it, but actually I have witnessed that incident. Lots of fatal conventional methods of treatment patients are practiced in different places around the world, especially in rural and most primitive areas where the medical services are not existing. More than 70% of death causes are resulting from using lethal treatment practices that may be more dangerous to the patients than the disease itself. In this video, I won't tell you about some practices I have seen recently in my daily life, but we will talk about some historical practices used in treating patients. The medical development in the treatment of patients began with rather slow steps and growth. Traditional methods of treatment have remained popular until not so long ago, but they differ in practices as they rely on society's lifestyles and their cultures. They include practices such as herbal medicine, acupuncture, Japanese medicine, massage therapy, and others. Despite the different practices, there were some strange therapeutic methods used in the past. For example, in 1946, a rather unconventional form of treatment of back pain was practiced in parts of Romania. The method involved using a bear, specifically trained one, to apply pressure to the patient's back in order to alleviate pain. This practice stemmed from ancient folk medicine traditions, which were still prevalent in rural parts of Eastern Europe at the time. The idea behind using a bear for this treatment was based on the belief that the pressure from the animal's weight and the specific way it would lie on the person's back could provide relief for certain kinds of muscular pain, including the back. The process was believed to promote blood circulation, relieve muscle tension, and ease discomfort. Although this may sound strange by modern medical standards, it wasn't uncommon for people in rural areas to turn to animals, nature, and alternative healing practices in the absence of more conventional treatments. The second practice was used in Bulgaria during the 1940s. Certain folk healing practices viewed back diseases as caused by malevolent spirits, curses, or magical elements. Healers were believed to communicate with the spiritual realm to diagnose and treat those applications. They used iron tools like an axe. While the axe may have been used ceremonially, its role was likely symbolic. Healers also considered themselves to have purifying powers capable of driving away evil spirits, cutting or severing the spiritual connection to the illness, and purify the area surrounding the patient. Moreover, verbal formulas or spells were crucial for communicating with the spiritual powers. The healer would recite an incantation to command the spirit to leave the afflicted body. This practice was common for illness believed to be caused by a curse or evil spell. Healers would often perform a series of ritual actions, sometimes involving water and herbs, while reciting the words. In some rituals, the patient would be led to the threshold of the house and the hearth, bowing to symbolize the crossing into a new state of health. For example, there was an elderly woman acting as a healer who would place bread in a clay dish over the fire, with iron tools placed on either side of the hearth for their purifying power, a kneeling patient on a broom to symbolize purification, and both the healer and the patient would recite incantations, often in groups of 3. The third practice was in Germany in 1890 in a mental health hospital. Schizophrenic patients were treated horrifically as a result of doctors' mistaken beliefs. In the late 19th century, ideas about mental illness were shaped by fear and moral judgment as much as by medicine. Many believed that harsh physical restraint or forced isolation could calm agitation or purge so-called madness. Devices like straitjackets, restraint chairs, or wall shackles were common. Patients might be tied up for hours or even days. Germany at that time, like other European countries, had a large state asylums that were often overcrowded and underfunded. Though some doctors did try to bring more humane ideas into psychiatry, restraint and isolation were still widespread. This method rooted in ideas of punishment and control more than care. While those forms of therapy has long been abandoned in favor of more scientifically proven methods, it remains an interesting historical curiosity, showcasing how cultures around the world have used unique, harsh, and sometimes unusual means to treat pain and illness. If you like the video, subscribe the channel.